I want to talk with you now about the real and present issue of burnout. Now, I don't want to get depressing. I don't want to get miserable. I don't want to focus on all of the downsides, but it is important to talk about this issue because according to a nationwide survey carried out by New South Wales Work Health and Safety earlier this year, 2 in 3 Australian workers are affected by burnout. It is a big deal. It's a big deal. It is also a deal that can be addressed if you know what to look for and what to do. And you'll hear some insight and advice from someone who's done their PhD in burnout in a moment. But Pam at the Gap, I'm so glad you called, Pam. Tell me about your story and your experience with burnout.
It was shortly after I'd had Ross-River virus, and so I think it was about 15 months of being debilitated anyway, but not wanting to be sick and just pushing through. So my body was under low-grade inflammation from that. I'm a stay-at-home mum. I was volunteering for everything, organising so much, and I had put so much pressure on myself to be everything to everybody, and I broke my brain, I reckon. It was like having brain damage. I couldn't, my capacity was so reduced during that time, and it took probably the better part of 2 years to just slowly accept, love, and be kind to myself, and let other people love me instead of being the carer myself for everybody else.
Wow, Pam. Wow. I'm glad I'm glad you've got to that point. Now where you are in your journey now, when you look back at that time when you were at peak burnout, were there any signs or indications that you can see now that you couldn't see at the time that might have suggested to you that you were on that path to being completely spent?
I think if I had said things that I was telling myself, if I had said that stuff out loud, I would have never have expected it of anybody else or even dreamed to say those things to anybody else and hold those kind of expectations. So I was my worst enemy.
Wow.
But yeah, having I used certain apps to try and coach my mind and try and figure out where these stories were coming from that I was telling myself about myself. Also found, just doing really easy Pilates or yoga to try and get the mind-body connection again was very helpful too. Yeah.
Pam, your proof. Burnout can be dealt with. You can do it. There's always hope, Pam. So I am, again, so glad you called. And I'm
thank you.
glad you found yourself in a different position. Congratulations, because it's been 2 years of hard work on your part, hasn't it?
Yes, it has.
Yeah, well done. Well done. Pam of The Gap on ABC Radio Brisbane and Gold Coast. We're going to examine some of the aspects of Pam's story, and maybe it's a story that reflects your own experience shortly, with Dr. Rachel Hannam, Clinical Director of North Brisbane Psychologists. How to get a handle on burnout. How to get a handle on burnout without burning everything down. That's coming up right after this.
Breakfast with Craig and Loretta.
Or if you're tuned in via the ABC Listen app, make sure you have it on your smartphone. It'll help you win. If you've got the ABC Listen app, you can just hit the Call Now button. You snooze.
You lose.
Nice and easy. Your clue we're asking this morning.
Oh, yes, the name of the song and the artist. I was looking at my phone thinking, I've never used that Call Now button.
Give it a go,
and I need to have a look at that.
You don't have to call, you're right here.
Craig and Loretta, weekday mornings from 5 on ABC Radio Brisbane.
You're listening to Cat Feeney on ABC Radio Brisbane and Queensland.
Burnout. It's a word that you hear all the time. It might be a word that relates to an experience you personally have had, either yourself or an experience that someone you love and care for has had. But what do we mean when we say burnout? What are the early signs or the indicators that burnout is coming for you, and what can you do about it once you find yourself accepting that you are burnt out? Dr. Rachel Hannam is the Clinical Director of North Brisbane Psychologists, and you've done your PhD on psychological burnout. Rachel, you're pretty qualified to tell us what we mean by the term. What does burnout actually mean?
Yeah, thanks, Kat. So the definition I looked at in my research included three main factors. The first one was emotional exhaustion, as you've said, just feeling spent, absolutely fatigued and drained. The second factor they called decreased personal accomplishment, but that's that feeling of you're just not getting things done, never matching up to your expectations, a low sense of achievement, even if you're working hard. And the other factor is called depersonalization, which is losing sympathy and empathy for people. So that's where people might have the thought of, I hate everyone. So they're the three main factors. But the other factor that's almost always there is loneliness. You know, people can work really long hours but feel part of a group or a team and not burn out. They'll just be tired. So also implicated in burnout is a sense of being all alone with the weight of the world on your shoulders. Melbourne University, among other institutions and organisations, has done extensive research trying to capture a picture of burnout in Australia at the moment, and it's pretty stark. It looks as though the majority of people who are working, and a lot of the studies focus on people who are working, but burnout goes beyond a professional or paid context. Yes. It
looks like the majority of workers are burnt out.
To some degree, yeah. And there is this thing of chronic burnout. I've worked with a lot of health professionals, doctors, nurses who are in a chronic low-level state of burnout, and it's not good for them or anybody around them. And when you combine feeling overloaded, under-resourced, interpersonal conflict, you know, with feeling a sense of loneliness or isolation, it's a real recipe for burnout.
And if you're in a situation where maybe you don't have an employer's counselling service available to you or HR interested in you, if you're at home, if you're caring, you might be just as likely to experience burnout.
Carer burnout is very real, and there's a lot of research on it. And again, it's that factor of I don't have what I need, I'm overworked and overwhelmed, and I'm all alone. You know, that social support factor that your caller spoke of earlier, asking for help, alerting your support system that you're struggling, and getting that social emotional support is such a huge factor in both avoiding and recovering from burnout. So people at home caring for others
can experience burnout. All right. So it's real, it's legitimate, and it's a widespread problem in Australia at the moment.
And I'd like to say, you know, it does have features of depression and anxiety, but it is distinct from just depression or just anxiety. I love the phrase, to burn out, you need to have burned. So a lot of health professionals I work with who have burnout, you know, they've burned pretty bright for a number of years, and then they burn out. The flame, the spark seems to disappear.
Yeah, so we want to find out from you in a moment how we can restore that spark. On ABC Radio Brisbane and Gold Coast, my name's Kat. Dr. Rachel Hannam is with you, and we're talking about burnout. Now, I was keen to hear if you had been there, done that, and come out the other end, you might have some insight and expertise to offer. And we heard from Pam at The Gap, who did a brilliant job of describing burnout and what it took in her situation to address it. But Hugh in Brisbane, you know burnout pretty well by the sound of it. Hugh, what happened?
Hi, Kat and Dr. Rachel.
Hi.
Thank you for this topic. A bit too well, to be honest. So short story long, I worked in the care sector for 20 years, education, behavioural support, a lot of nursing, disability, all that kind of stuff. And I really relate to what Dr. Rachel was saying, where I found myself having a lack of compassion for my clients. And as a disability support worker at the time, that, you know, obviously a key part of the role. And one of the skills where I was like, okay, I like to think, you know, I'm pretty caring, I can do that. And I struggled to find that. And the patience where I'd usually have for my clients, I wasn't having anymore. So I slowly, was taken out of that industry, and for good reason, because, I wasn't able to give the best to my clients that I could. And then, took some time off to look after the little one. But the beautiful part of it is, Kat, and I love that you said that let's focus on some positives as well. It allowed me to reevaluate and go, all the compassion and energy and patience that I have, I want to keep that for my family and be a little bit selfish. So I'm doing that now, and I'm working in warehousing. So I'm just basically playing Tetris for a living and loving it.
Oh, wow, Hugh, I'm glad. It's that saying no to say yes, Dr. Rachel Hannam. And I think Hugh's story is one that, again, reminds us that you can come back from burnout. So let's take that time now to look at some of the things you can do. If you found yourself in a place where you're burnt out, you feel you might be, then what?
Yeah, so if you can't avoid it because you're already too far gone, the first step is, stop what you're doing. Extreme stress requires extreme self-care. So I've had clients who've had to quit their jobs or take 6 months leave without pay, similar to our last caller, maybe leave their job entirely. And so get help immediately if you're really burnt out, and alert your support system that you're struggling, like I said before. Put in place self-care and stress management, but practicing self-compassion would have to be my number one tip. And your first caller Pam mentioned self-compassion practices. And I often say, self-judgment is automatic, but self-love is on purpose. Our instinct is our negativity bias, and that will make us judge ourselves and others automatically. So practicing self-kindness, self-tenderness and self-compassion is a skill. It's a practice that is quite deliberate and conscious. And really, what's the alternative? If our minds are full of negative stories about ourselves and the world, that's pretty human, that's pretty automatic. We need to somehow short-circuit that negative self-talk and bring in words of kindness and compassion. And self-compassion can be active, like going getting a massage, looking after yourself, eating better, sleeping better. And it can also be how you speak to yourself. And the simplest exercise is, how would I speak to a friend? Pam mentioned it. How would I speak to a friend going through something like this? Would I talk to him or her like I'm speaking to myself? No, I wouldn't. So sit with yourself and talk to yourself like a best friend would, or a kind, caring coach, and cultivate that inner best friend or that inner coach to talk to you with gentleness and kindness, because the self-blame and self-judgment will keep you locked into a negative loop inside yourself and you won't recover.
Ideally, we can prevent burnout before it gets to that extreme end of the spectrum, although it's good to know that you can come back from that.
Yes.
So in terms of prevention, Dr. Rachel Hannam, some simple ideas that we can carry with us from today.
Well, notice those signs early. If you start having negative thoughts about others or doing a lot of self-judgment, that could be a sign. Maybe you're acting out. Maybe you get home and you kick the dog, so you take it out on something else. Notice the early signs and just step back and assess, what do I really want? Because some of the health professionals I've worked with are pushing themselves, as Pam said, your caller, trying to be all things to all people all the time. It's real self-sacrificing schema and unrelenting standards that they hold themselves to. But it's not really what they want for their lives. So catch it early, step back, ask yourself, what do I really want? Get some support and some advice around that from someone you trust or a therapist or a coach, and set some boundaries and make some decisions so that it doesn't turn into full-blown burnout.
Yeah. Those boundaries are a big one. Do what can feel good, and remember that you don't have to do everything all at once.
It's okay. Yes.
It's okay. It's okay. All right. Dr. Rachel Hannam, are there some resources that you recommend, or books or ideas that we could maybe look to for further insight or understanding of the issue of burnout? What have you come across in your PhD, obviously, available?
Yeah, I was going to say I could recommend some very academic articles and texts that people are not going to enjoy. Look, anything by Russ Harris on acceptance and commitment therapy. Let me think. Some other books. I wish I'd prepared for this question, Kat. I think there's some really wonderful videos on YouTube. I wish I could think of the names, but Googling burnout recovery on either, Google or searching it on YouTube will pull up some really good, popular videos. And I think I've got some videos on my YouTube channel, North Brisbane Psychologists,
there you go,
on recovering from burnout as well.
Dr. Rachel Hannam, thank you very much for your time.
Thank you, Kat.